All right, guys, welcome to the show today. I've got a good one lined up for you. I'm going to be going into, basically why the way most of our doctors in this country, talk about, health the wrong way. They blame it on genes. They blame it on age. I'm here to tell you that is the furthest thing from the truth. Absolutely the furthest thing from the truth. And we've known that for years now. So, I want this show to be more about like you guys getting completely away from this idea that you're just a product of your age, you're just a product of your genes. So we're going to go over things like hormone optimization. I'm going to be talking a lot about men today, and specifically things like testosterone, libido, some of the biggest things that plague men's health, and so I'm going to be diving into some of those topics today, and again, this is going to be a good one for everybody, but especially when you're looking at like the excuses that are given out, guys. I just want to fill your mind with the idea that, again, you're not a product of your age, you're not a product of your genes, you're a product of your choices. We are a product of choice. Even though we're a society that doesn't like that idea. We'd rather let somebody else take responsibility for our health, or somebody else take responsibility for our finances, or somebody else take responsibility, for our actions. So we're not going to do that on this show. We're going to actually go over the fact that you are responsible. It is your choice. So we're about to go live, so hang on. All right, guys, welcome to Wellness Radio. I am your health expert, Dr. Nathan Warren. Thank you, Dr. Rebecca, for doing the first little segment there and kind of setting us up for today. So I've got a great show lined up for you guys today. We're going to be talking all about, really some of the biggest things that plague, men's health, mainly because I get sick and tired, and I labeled this on our Facebook Live. So if you're just joining us now on Facebook Live, welcome. I labeled it this. I'm so sick of doctors labeling health problems as age problems and genetic problems. I mean, even today, like even after all of these years, of research that's coming out that's showing that again, it's not just about your genes. Like your genes are influenced by your environment, both internal and external environment. It's amazing how many doctors still are doing, still saying the same thing to their patients. Like, I don't know if it's just that they don't know or if it's just that they don't care, because it's got to be one or the other. Either they don't know, which means they're not taking the time to read the latest research. It's not even the latest research. I mean, we've known epigenetics is the primary, the primary driver in the health of our genes and what's expressed and what's not expressed, for years. So it's either they don't know or they don't care, one or the other. But I'm sick and tired of it because, again, when I sit in front of a new patient in my office, I hear the same story over and over again, and they still say the same word. Well, I've got high blood pressure. I take just a little pill, but again, my mom and my dad had high blood pressure, or my brothers have high blood pressure, or my grandfather had high blood pressure, and I'm like, that has zero to do with you, nothing to do with you. Even though you may be genetically predisposed to having some issues with blood pressure, guess what? That doesn't just magically happen. That happens because the environment that you created, whether it's the foods that you're eating or not eating, whether it's the exercise and movement that you're doing or not doing, whether it's the dirty air that you're breathing in, maybe it's the massive amounts of stress that you're putting yourself under and not helping yourself adapt to, maybe it's the toxins you're being exposed to, whatever that is, that's what's influencing, again, that genetic expression of, you fill in the blank symptom. And so again, it's not your grandfather, right? It's not his genes that are doing it. It is your choice that's doing it. Excuse me. It's your choice that's doing it. So the quicker we realize that, the faster we can get to a solution. And so that's what we're going to be going over today on the show. Now, as we dive into some of these things like hormone optimization, libido, and those type of things. Definitely make sure, if you are live on Facebook right now, please, if you have a question, let me know. I'll try to answer those as we go, because I know that again, as we go, it's easy to think of questions. If you want to call into the radio show, you can absolutely do that as well. That number is 267-1023, 423-267-1023, and you can ask your question there as well. So again, guys, I like questions, especially the ones that are more relevant to what we're talking about here. So now let's kind of start here, and this is a big one. We know that there's certain things that specifically affect genetic expression the most, okay? And this is what I see mostly in my men's group. I just got done doing another men's group, another successful one where we got to see, several men losing lots of weight. We got to see them all increasing their energy. We got to see them excited about living life again, right? Out of all the things that they could see symptom reduction in, my favorite part of it is they got to see that you know what? Life can still be full of energy. Life can be full of happiness. Life can be full of joy. Some of them, their families are liking them better now. They're like, hey, we haven't seen you in 20 years because, again, now you're you. And so, we just got done with another men's group, and I love to see people go through that transformation. I love to see them go from point A of feeling like crap, run down on all kinds of medication, to point B where they're starting to actually discover that their life is coming back, that their vitality is coming back, that their energy levels are coming back. And so that was only in like a 7-week process that we got to see those things starting to happen, and them starting to get metabolically well, and them actually getting answers to their health issues, and actually going through the process and learning the process. We get to see those things happen. So I get excited about it, and we will be starting a new men's group pretty soon, so I'll kind of touch on that in just a minute. But I'm super excited because these men are learning that it's their choices that drive their health outcomes. All right? So let's be very clear about this. Your choice drives your health outcome. That means, yes, if you have cancer, your choices have driven your health outcomes. What about if you're a child and you have cancer? Well, okay, that's a little bit different. We know that, again, really the environment that the baby's in may have driven their health outcomes. So that's it. Maybe that's a whole nother good point, is that your health sometimes doesn't just influence your health, it influences future generations as well. So making sure that we're actually taking control of our health from that standpoint. But there are a few things that drive genetic expression, and so I kind of want to dive into that first, just to get that out of the way. Then I'm going to go into some of the anti-aging hormones that we see really that are really important, that most people have not optimized. All right, so we know that things like, obviously, toxins can drive genetic expression. So we know things like heavy metals, mold. You guys have heard me talk about this before. That will drive genetic expression. We know that, again, there's been studies done on mothers and babies. For example, there was one, Dr. Rebecca talks about this one, blew my mind. There was a study actually done looking at mothers and their health, specifically the amount of mercury in their mouth. So when they get those silver fillings, the amount of mercury that was in the mother's mouth was literally correlated with, they showed that there was a direct correlation to a rise in thyroid disorder, specifically things like Hashimoto's, and seeing that go in that direction, Hashimoto's, cancer, those type of things in the thyroid, based on the amount of mercury in the mother's mouth. And so, that being said, you take this little kid, and it turns into a teenager or an adult. They go into their doctor. They're like, "Oh, you have thyroid cancer. Oh, sorry, it's just in your genes." But they didn't explain to him that, hey, maybe it's being expressed because your mother has 8 different amalgam fillings in the mouth. So, do you see where I'm going with this? This is one example that your lifestyle choices influence gene expression. So again, scenario, person goes in, told they have cancer and told it's in their genes, but not told that this is what drove the gene expression, okay? And so this is a vitally important point, because this goes across the board. So toxins are one that will drive that. Heavy metals, mold. We know that things like BPA, BPS, phthalates, those plasticizers, all of those things that you find in plastics and beauty products and all of that, that will drive genetic expression. And we really have no idea how far that drives it. So just be aware of that every time you put a medication in your mouth. Be aware of that because every medication has side effects, okay? Be aware of, anything that you're putting into your body, anything you're consuming, anything that you're actually, like beauty products that you're putting on the skin. If they're containing toxins, if you don't know what that says on the ingredient label, then guess what? Your body's probably not going to recognize it either. And yes, that can drive gene expression. So toxins. That's a big one. Number 2, methylation issues. So methylation. So how are you methylating? Really, how well are you utilizing things like B vitamins within the cell? How well are you able to detoxify certain components of the cell? For example, like estrogen, methylation plays a major key role in that. Methylation is really what protects your DNA. It protects it from those genetic hits. We know that glutathione is involved in that process, your master antioxidant. And so many people, up to 60% of our population has methylation issues. All right. And again, the reason we're seeing this go further and further, and we're seeing more and more people that are having methylation issues, is because of genetic expression from one generation to the next. We have generations that are getting sicker and sicker and sicker. We have generations that are getting more exposed to toxins over time. We have generations that are eating more artificial and genetically modified foods and not real foods over time. We have more of a society that's focused on social media and sitting down at a video game and playing those for hours than being out in nature and running and playing and actually getting their feet on the ground. We have more of our population that's decreasing their amount of breath and moving into, like, literally, instead of taking like deep breaths and actually like breathing on a regular basis, they're shallow breathing and they're losing their posture. So you can see that we're literally on this downward slope in our society, which is why when you actually look at my parents' generation, they are the first generation in the history of the United States expected to die again before their parents' generation, and that is very, very sad. So we know that we're moving down the wrong pathway. So that being said, we need to make sure we're addressing things like toxins and methylation because they affect genetic expression. So I got to take a quick break here, guys, here on Wellness Radio. And so, again, if you have a question here on Facebook Live, I will answer it, especially during the break. If you have a question and maybe you're driving in your car, maybe you're on your way somewhere, that number is 267-1023. And I just want to let you guys know that if you go to doctorswarren.com, guys, there's a little banner there. We are open enrollment for my next men's group that's going to be starting in mid-March. I cannot wait, guys, and you can go and check out like our page there on doctorswarren.com. Click on the banner, and you can actually read all about my men's group. You can find out exactly what we're going to cover on each topic in each week. You're going to find out all that information there. You're going to get to see some testimonials. You're going to get to see kind of the whole process. But if you are a man and you're anywhere in the Chattanooga area, or if you're anywhere else in the United States of America and you want to do this program, guys, and you want to transform your health, you want to learn how to take control of your libido, you want to learn how to take control of your energy, you want to get your life back, you want to get your vibrancy back, and you want to start moving down the pathway of being metabolically healthy and getting to a point where your doctor can work you off of some of your medications. If that's you, then you want to go and check out my men's group. Again, doctorswarren.com, DRSWARREN.com. Every single man that's listening to this on the radio or on Facebook Live that hasn't gone through it yet will benefit. I don't care if you think that your health is at an advanced level, you're going to learn stuff you did not know, or if your health is at an abysmal level, you're going to learn the stuff that's going to save your life. So again, go to doctorswarren.com, DRSWARREN.com. Check that out. Also, too, you can give Kate a call. She's right here at the office, and she'll set up a free 10-minute consultation with myself over the phone. We're literally just going to dive in and find out if you're a good fit, because I want to make sure that every single person is a good fit for my men's group. So I had a few people, last time around that I didn't feel like were a good fit. I didn't think that they were quite ready to make those changes. And I want to make sure that what you're investing in, you're going to get a return on it. So you can give her a call. That number is 423-362-5360. Again, that's 423-362-5360. 362-5360, and you can give her a call. She'll set you up again with a free 10-minute phone call with myself, and we'll dive in and find out, hey, are you a right fit? I'll kind of find out a little bit about your story, what are your health goals, and I'll kind of let you know from there if this is a good fit for you doing my men's group that's coming up mid-March. We're going to be doing it live in person here in my office, and also on Zoom. All right, so we've kind of got a couple options there as well. So if you're from a different state, we can set you up on Zoom super easy. All right, guys, so this is Dr. Warren on Wellness Radio. I'll be right back after the break. All right, guys, so here on Facebook Live, let's keep diving into, some of the information here. So we went over things like toxins can affect your genetic expression, methylation issues can affect your genetic expression, and by methylation, usually, again, you guys can kind of see, this is kind of genetic changes that have happened because of previous generations. And again, those could be, those are all lifestyle related, changes over time. We know that our diet can affect genetic expression. So that means, how are we eating? What type of foods are we consuming? Are we consuming more towards like, an ancestral type of diet that's full of, good quality meat, vegetables, fruit, nuts, seeds, tubers, those type of things that again are there, tons of good healthy fat. Are we eating more of an ancestral diet, or are we leaning more towards, the kind of modern day, Western diet that's full of like highly processed food, now is apparently going to be full of like, all this synthetic fake meat, which, anybody who thinks that's a good idea, I honestly question your level of intelligence. That synthetic meat is a great idea. That sounds like literally one of the worst ideas we have ever came up with in the history of mankind, especially when you can actually, all this talk about, climate change and animals and all. Guys, animals are needed. Even if you're a vegan, animals are needed for you to get the most nutrient-dense food on the planet, period. That's just the way things work. That is just literally the way things work in our world. And so there's many different farms out there that are doing it the right way. So we know that again, really the way back to rediscovering healthy soil, healthy atmosphere, healthy world is through regenerative farming. And sorry guys that maybe don't like this, that involves animals, and that involves, plants, and that involves, eating more of an ancestral diet. And so again, in the realm of gene expression, in the realm of methylation issues, these are things that will actually impact your genes. We know that toxins, methylation issues will actually impact your genes. Now, there's other factors that do as well. We said diet. We know lack of exercise does. We know that even things like lack of good quality air and lack of the amount of air that you're getting in will directly affect. So the amount of oxygen you're getting to your tissue, you have no idea how much there is a lack of good quality oxygen getting to your tissue. I'll never forget one of my professors in school who was a world-renowned radiologist who was involved in an autopsy study early on in his career that actually looked at, how much of their lungs were people using, and it was like over 80% of the population that they studied hadn't even used the lower lobes of the lung hardly at all throughout their lifetime, which means they were just shallow breathing pretty much their whole life, which is what we do under stress. So remember, these are things that impact your genetic expression inside your body. Now notice, I haven't said age, right? Notice, I haven't said accidents. It just happened one day. Whoops, my gene, just turned on. It doesn't happen on accident. It happens because of a reason. All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. And today I'm talking all about how to regain your health, how to kind of get past the lie. And yes, it's a lie. How to get past the lie that, age and genetics are the only things that's affecting your health. And that's why you just need to be on this medication for the rest of your life, or you need to have this surgery or that surgery. Guys, bottom line is, we know that by cutting, poisoning, burning, we know that sometimes those things can maybe save your life in the moment, but they don't optimize your health and they don't fix the problem. So you cannot cut, poison, and burn yourself to health. It's just not going to happen. So even if that stings a little bit, maybe you're somebody that like literally, worships the ground of our medical system, which again, don't get me wrong, I take care of a lot of the most amazing medical professionals on the planet, nurses, doctors who are saving lives on a daily basis. But they also recognize that, hey, you know what? Even though they save lives in that realm, it's not about optimizing your health and wellness. So again, that's the area that I work in. And so again, not saying I'm not thankful for our medical system. I very much am. When it comes to an emergency situation. But when it comes to overall health, again, you're not going to get it from a broken system there. They're not designed for chronic disease, which is why, again, they're failing miserably at chronic disease. That's why diabetes is on the rise. That's why Alzheimer's and dementia will bankrupt our country, over time. That's why we have higher rates of autism. That's why we have higher rates of ADD, ADHD. That's why we have higher rates of cancer. We have higher rates of heart disease. Guys, these things aren't getting better because you're relying on a system that's not meant to deal with it. And so, now, let's kind of dive into, so we talked about some of the things that can affect your genetic expression. Even things like mineral and vitamin deficiency can affect the way your genes are expressed. Specifically, certain minerals, like we know zinc, we know things like selenium, we know things like iodine. These things can actually affect whether you are genetically or whether you're expressing certain genes that are going to lead to disease, or whether you're not expressing those genes at all. So we know lack of minerals, we know lack of vitamins, which again, things like vitamin A, D, E, K, these things are absolutely missed in our modern diet. Like most people, their levels of vitamin D that they're getting are coming from their fortified conventional cow's milk that's full of vitamin D2 that's not even absorbed very well into the body. So we know that the massive lack of vitamin K2. How do we know that? Because osteoporosis and osteopenia and the amount of bone loss that we see, the amount of dental caries that we see, the amount of literally decay in the teeth, we know vitamin K2 is missing from our modern diet quite a bit, and we're missing the bacteria that also can help produce something like vitamin K2. So vitamins can play a major role. B vitamins, for example, the majority of the crap that people consume are loaded with synthetic B vitamins. They're not even loaded with good quality B vitamins, and some of those are not even attached to methyl groups, which we just went over. About 50 to 60% of our population have what are called MTHFR gene SNPs, or issues with that genetic sequence. And so guess what happens? You're literally not methylating appropriately, and you're not getting the B vitamins that are attached to that methyl group. So we know that this is a very, very big deal. Now, when it comes to gene expression, that's one side of the coin. But we also know that in order for you to be able to live a happy, long, healthy life, that again, we have to include things that are really going to drive proper function at a cellular level. So that being said, I want to talk just a minute about a couple hormones that we have to get in line and really get expressed on a daily basis, because if you don't, you will age quicker and you will have more degenerative problems than ever. All right. So the first one I just want to talk about a little bit is growth hormone, because growth hormone is a major part of your anti-aging systems. Growth hormone is a major part of your repair mechanism. So how you rebuild, how you repair, this is very, very important. And most of you guys, your growth hormone is depleted pretty massively. And we've known actually for years, things like injecting, human growth hormone or getting human growth hormone replacement has been absolutely terrible for human health. I've seen some teenagers who, one specifically that I can think of that I'm now working with, that was given, growth hormone treatments because they said, oh, we just think he's too small on this, magical, scale that we look at, where kids have to fall right in line with the scale that we look at, which, by the way, is an absolute crap of a joke. But anyway, I'm not going to get into that. But anyway, so they gave this kid growth hormone injections, and literally his mom said, you know, they saw, like, because he had seen a chiropractor before, they saw that his spine had literally went into a scoliosis curve and had some issues. So I've got to take a quick break. I'll finish that story when I get back. If you want to set up a free consultation, you know, to come in and actually join my men's group, 10 minutes on the call with me so I can find out if you're a good fit for that, you know, you can give Kate a call. That number's 423-362-5360. Again, that's 362-5360. Give them a call. You can also go to doctorswarren.com and you can actually, you know, click on the banner there about my men's group, read all about it, find out the topics, listen to the testimonials. It's literally one of my favorite things in the world to do and help take your health back to the area that it should be, or maybe for the first time, take your health to an area that you've never been before. So again, 362-5360, 423-362-5360, and she can set you up for that 10-minute phone call so we can find out if the men's group is the right fit for you. Or you can go on our website, doctorswarren.com, and you can actually click there, find out all about it. You can even sign up there as well for it. So when we get back, we'll continue to dive into you know, this whole idea that genes and age are not the issue, and really what type of hormones are driving this. And so again, guys, this is Dr. Warren on Wellness Radio. I'll be right back after the break. All right, guys. So let's kind of keep going where I was going. I had to go to a break really quick. I'm really bad about that. You know, not hitting the brakes when I need to. Thank God we got a very forgiving engineer here who's amazing at what he does. But I do a really bad job of getting to break at the time I'm supposed to, because I'm excited about what I'm talking about. But anyway, so this kid that I was working with that got growth hormone again replacement. And so this kid, literally, his mom said they saw his spine go from straight to, when we x-rayed, you know, he had about a 24-degree scoliosis curve in the mid-back. He had about a 32-degree scoliosis curve in the lower part of the back. And so we actually saw his spine change because of hormones. Yes, that can happen. That can absolutely happen. She said she saw, you know, kind of this like, you know, like happy, bubbly, loving boy go into like this just angry person all the time. They saw, you know, him go from, you know, this kid that had clear, beautiful skin to, you know, things like acne, and sometimes even like cystic acne. So they saw all these changes happen, you know, with this kid because they gave him growth hormone because they said he didn't meet the criteria on a chart. Which again I think is absolutely ridiculous. That's where they throw logic out, because if they look, they're like, oh wait a second, his mom is, you know, like, you know, 5'1" and his dad is like, you know, 5'6". Like, of course this kid's gonna be small. And you can tell I get really angry about this because the same thing almost happened to me. Like, I remember being, I think it was 10 or 11, and my pediatrician told my parents that, hey, he's just not growing quite a bit, you know, he's not growing enough. You know, so we need to get him checked. So they literally sent me over to Vanderbilt for almost an entire day. I got like blood work, you know, taken from my arm. And they come in at the end of it and they're like, well, you know, blood work looks pretty normal, but because, you know, he's on the smaller side, we think we should give, you know, growth hormone injections. And I remember my dad and mom being absolutely ticked off. Because they're like, look at me. I'm like 5, you know, my mom's 4'11" and my dad is like 5'6". And you're not even thinking logically. So we've got to think logically, guys. All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren, and I'm usually here. I was about to say I'm here with my beautiful wife, Dr. Rebecca Warren. I am not here with her right now. She's actually getting ready for my son's 5th birthday party, which is so flipping crazy to say. 5th birthday party, man. Time flies. But it's going to be awesome. Like, he's, for almost a year, he said, I can't wait. I want to have a Halloween dance party. So that's the theme of my son's, 5th birthday, which is going to be a lot of fun. But anyway, let's kind of dive back into what I was talking about. I was finishing this story about a kid that I was working with that was getting growth hormone injections, and I went into a story about like why that ticked me off, because of all the symptoms that he showed up with. His life was being ruined, and it really made me mad because that almost happened to me. Had it not been for my mom and my dad at Vanderbilt Hospital saying, Children's Hospital saying, you know what, this is crazy. You want to give my son growth hormone injections because he doesn't meet your criteria on a chart. But yet when you look at it, when you look at him overall, like my wife is 4'11", and I'm 5'6", that doesn't make any sense. Thank God my dad and my mom were thinking that way, and I didn't get them. But growth hormone plays a major role, in overall health, and most people are not getting the proper amount of growth hormone. So when we're looking at growth hormone overall, there's a few ways that we actually get growth hormone. So one is going to bed at the proper time. So we know that we have to go to bed at the proper time. It's very, very important when we're looking at getting what we need to get out of it. So between the areas of 10 to about 12, we need to be in bed, because that's when we're going to actually get some growth hormone production. So we've got to get it there. We also have to pay attention to, again, getting proper exercise. Because if we're not getting proper amount of movement, proper exercise, specifically metabolic training, which I like is as far as things like high intensity interval training, maybe some actual power lifting or heavy lifting, you're going to get some great growth hormone production there. Fasting. We know that fasting will lead to an optimization of growth hormone. It's going to increase the amount of growth hormone that you get. So yeah, not eating anything on occasion will optimize hormones. That's not an opinion. That is a fact. So those of you that want to build muscle and you're just stuffing your face all the time with food, you're missing out on probably your greatest tool, which is not stuffing your face with food on occasion and actually seeing that growth hormone optimization going up. So there's several different factors that are involved there, and in all of those, we can see majority of our society are lacking, and so again, they're missing out on that anti-aging hormone because they're not exercising, they're eating like crap, but they're eating like crap every second of every day, and also too, they're not getting to bed at a proper time to actually get proper growth hormone, again, production there. So you can see we're missing out on that anti-aging hormone. And there's other anti-aging hormones as well. We know testosterone is one of those, which I'm going to get into again in our next segment. I'm going to make sure to get into the testosterone area. We know things like ghrelin and leptin and cortisol all play a role in the aging process and in our metabolic health, because the more metabolically damaged you are, so that means the worse your blood sugar is, the worse your insulin response is, again, the sicker you're going to be overall. You will be sick. So you cannot be pre-diabetic and healthy, period. Can't happen. You cannot be diabetic and healthy. That is impossible, because you are literally sick and dying at a cellular level. So we're going to dive more into that on our next segment, because yes, guys, I have another 30 minutes that we get to go through as far as this information goes on how to really return to that weight loss area that you want to get to, or increasing your libido, increasing your vitality, increasing your energy. We're going to dive into all of that throughout the next 30 minutes. And so if you're listening to this and you want to join my next men's group, if you're a man, you need to join my next men's group if you haven't gone through it yet, because we dive into all of the latest and greatest information on everything it takes to be a healthy man. And I teach you that process. You learn how to do that for the rest of your life. And we do that across 7 weeks. So you can do one of two things here. You can give Kate a call, 423-362-5360. Again, that's 423-362-5360. And you can actually set up a free 10-minute consultation with myself on the phone to find out if the men's group is the right fit for you. Also, you can go to doctorswarren.com and really find that out as well too. Click on the banner, find out more information. I'll see you guys in the next segment. I got 30 more minutes here, so definitely hang on and listen to the rest of this show. This is Dr. Nathan Warren on Wellness Radio. I'll see you right back after the break. All right, guys. So during this break, I've got about, I think it's about 5 or 6 minutes here before we go live again. So I really want to kind of get back into where we're at and give you guys a lot of information. If you have any specific questions, make sure that you ask, because here live on Facebook, again, I can kind of personalize it to you if you have questions. Maybe you're a man and you're having some type of health issue. Maybe you're going through something like heart disease. Maybe it's cancer. Maybe it's low testosterone. Maybe you're a man that has been getting testosterone injections and you're wondering if that's the right way to do things. Maybe you're a woman who is having some hormonal issues as well. Maybe you're somebody that wants some anti-aging strategies. Whatever that may be, ask your questions and I can definitely answer those for you. And also too, guys, if you enjoy this information, like it and share it, because that's how we get it out to people. In a world that's full of all kinds of crazy misinformation, we need to get real health information out to people. So we ask that you like and that you share this information. It's super easy. It literally takes a second to hit that like and share button. All right. So we were talking about growth hormone, and just as a recap, there's several ways to get proper growth hormone production. One of them is going to bed at the right time, going to bed early, not missing that kind of golden window, that 10 to 12, or really more like 10 to 11, 11:30. So we want to go to bed during that period so we get growth hormone production. We also want to make sure that we are getting some type of good activity as far as movement in. So that would be things like, high intensity interval training. Maybe it's like powerlifting or just lifting heavy things. Really seems to have the biggest effect from an exercise standpoint on growth hormone. And you don't have to do those things every day. You can do them every other day. You can even do them, 3 times a week and see major benefits in your growth hormone production. Fasting is going to be a big deal. We know that when you fast, you optimize growth hormone. We get to see that kind of surge in some of these anti-aging hormones. So utilizing some fasting techniques are brilliant. And actually, I would say absolutely necessary for you to live a long time and a happy life and a good quality life. You're going to have to implement some fasting strategy. If not, you're not going to optimize some of these amazing hormones that you get. And then, the other one that I had mentioned as well is things like, the foods that we eat, the type of food that we eat. Guys, if you are loading your body with industrial commercial meat that's out there, guys, you're getting, meat that's been injected with crap. You're getting meat that has literally been, like I know with cows, for example, they actually put what's called an aflatoxin or a mold toxin. They put it in the ears of cattle in order to see massive growth, because it metabolically disrupts these cows so that they gain a lot of weight in a very quick way. So guess what you're getting when you consume that conventional meat? You're getting those things. So guess what this is going to do to you? Next thing you know, you're 100 pounds heavier than you were 5 years ago, and you're like, what the heck happened? Maybe you're somebody that's still working out and you're still doing some of these things right for your health, but you're still eating crap meat. You're going out to restaurants and eating, these non-organic or non-pasteurized meats. And so, again, I'm not telling you to go out and be vegan, because I don't think that's a great thing either. And then that's coming from literally seeing thousands of patients, actually tens of thousands of patients now over the last several years, and kind of seeing the differences in diet. So I think meat is a major part of a healthy diet, but I am also in the camp of conventional meat is poison and it's sick, and it should never be consumed. We should be consuming pasture-raised, meat, things like, whether it's, beef or bison or lamb or, venison, but they should be literally raised on pasture. They should be raised the way that they're meant to be raised. Or even some wild meats like elk or wild boar or some of these type of things. They should be raised the way they're supposed to. Fish and seafood should be wild caught. They should be, literally caught like our ancestors did. And that's the type of meat that I'm talking about. But yeah, if you consume meat that's been injected and literally, coming from a sick cow, guess what you're going to get? You're going to get hormone issues. Yes, it's going to affect your growth hormone levels. Now, the other hormone, because growth hormone is one, But there's other anti-aging hormones, and there's other hormones that play a major role in this. One of these being testosterone. And testosterone is going to be a big one that I talk about in the next part of the radio show, because testosterone is a big buzzword nowadays. And don't get me wrong, like having the right testosterone levels literally will dramatically affect your overall health. You know, whether a man is going to get heart disease or whether a man's going to get prostate cancer, there's a big determination of that based on what your testosterone levels are right now. And so testosterone, let me just give you a good idea of what it does inside the body. And specifically inside the male body, we're talking about muscle growth. So building like mass, strength, muscle mass overall, and seeing that, which we know that the greater your muscle mass is, especially as you age, we know the greater, that literally is associated with longevity. So how far you go. So yeah, I mean, I hate to say it, you maybe, if you decide to go 100%, 100% plant-based, maybe you live a long time, but you'll also be pretty frail and again, like pretty weak as you go. I don't necessarily want to be that as I age. I'd like to get benefits of both there. So we know that plays a major role there as well too. So we're going to be diving into testosterone and everything here coming into the second segment, and looking at male and men's health issues, and it's going to be very, very good overall. So as we dive into it, if you have any questions, please let me know, and we can absolutely dive into it. All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I'm here for the next 30 minutes of our show, where we're going to really dive into, some of the best health topics, that I think affect your health overall, from the perspective of, getting away from this idea that aging and genetics are the only thing that basically express disease. So, if your doctor has ever told you that you are a product of your genes, or sorry, you have this cancer because you have this gene, like maybe you're a woman that's, went in and you've had breast cancer, and they're like, we're going to test your genes. Oh yeah, you've got this gene and that gene, you're BRCA positive, so guess what? There was nothing you could do about it. That's a load of crap, all right? I understand that there's certain genetic issues that happen, maybe from birth. Like, I understand things like Down syndrome, even things like cystic fibrosis, and some other types of genetic diseases from birth. But I'll tell you right now, things like cancer development, heart disease, diabetes, the majority of that is going to be because of choice, not because of genetics. It's going to be because of choice. And so, maybe that's hard for you to swallow. Honestly, I don't care. I don't do this radio show to make friends. I do this radio show to bring about the right information. And I'm telling you, when your doctor tells you that you have high blood pressure, or you have high cholesterol, or you have, high blood sugar, or you have, this symptom or that symptom, and it's because of genes, I would question that, and again, more than likely, it's so that they can put you on a drug for the rest of your life, send you on your way, and yeah, maybe that symptom goes away, but you're covering up the root cause, which means that fire is burning on the inside, and then 5 years down the road, you have a heart attack and you wonder why. Or 5 years down the road, you're diagnosed with diabetes and you wonder why. Or, 10 years down the road, you literally wake up and you cannot remember your spouse that's laying there. And then when you come to a little bit for a few minutes before you go out again, you're like, holy crap, what's happened to my life? And so again, I want you guys to realize that genes and age are not the disease process that your medical doctors are making it out to be. So let's kind of dive into some of the things that are. So I've talked about, methylation issues so far can be an issue with driving genetic expression. I've talked about toxins. I've talked about, lack of proper diet, lack of proper exercise. I've even talked about some hormones that play a key role in the anti-aging process that we need optimized. I specifically dove into growth hormone and what you can do about that. And if you're just now tuning into our show, you can actually, go back and recap this show if you go to drswarren.com and you sign up for our newsletter, so drswarren.com, sign up for our free newsletter. We send out a recap of our radio show every single week so that you guys can get the latest and greatest information on that. And again, it's free. It's an easy resource that literally contains all kinds of great information. We get told every single week how amazing our newsletter is. So again, go there, sign up for it. It's one of the best ways to get, again, kind of uncensored, good quality information about health and your health journey. But we do a recap of our radio show. So if you missed the first part of it, go to drswarren.com, sign up for that newsletter, and we can definitely make sure that we get that going. So I want to talk about another one, testosterone. So let's dive into testosterone here, and let's look at some of the major benefits of it. So testosterone, even though it's a buzzword in our society, we got men going out there getting injections. We even have commercials all the time talking about, are you a man that's losing your vitality, that's lost your libido? Come and get testosterone injections because testosterone replacement is the answer. Wait a second. So the answer to your testosterone issue is that you need to get injected, or you need to have a pellet inserted inside of you that's going to give you your testosterone for the rest of your life. That doesn't sound like a solution. That sounds like you having to rely now on a broken system that's telling you that nothing you did in your lifestyle created your testosterone issues, that you just need some type of pellet or some type of injection to live with the rest of your life, and that's going to help optimize your health. That's a load of baloney. That's a lot of crap. There's so many different things that you can do to help optimize testosterone levels. But testosterone specifically affects muscle growth. So again, things like muscle mass and strength. It affects skin. So like looking at facial and body hair growth. So again, some of you men or women that are losing your hair and you're like, what the heck is going on? And you're blaming it on your mother's side of things or your dad's side of things. You're blaming it on your genes. It might just be a hormone issue, and testosterone might play a role. Whether it's too much or whether it's too little. It also supports collagen production. So testosterone plays a major role in collagen production, which is very, very important, because how many people do we see, in this office all the time? They're like, oh, doc, I wrestled when I was in school, or I played football, and I've got arthritis in my knee or in my shoulders, and my doc said it's bone on bone, and there's nothing you can do about it until I get them replaced. And I'm like, wait a second. So yeah, there's nothing that you can do, but yeah, we know that, for example, one study, and there's been several studies, one study showed that getting a proper amount of collagen in their diet over the course of 5 years, or 6 years, I think it was, they actually saw over 50% of their cartilage in their body and collagenous tissue completely regenerated and replaced just by getting that in the body. So guess what? I hate to tell you, but again, you might be being lied to in your doctor's office. Bone density and bone density maintenance, testosterone plays a major role in that. Brain, so literally the way certain neurotransmitters work, the way your mood is, the way that things like your sex drive and libido, even all the way down to the way things like your pineal gland works with melatonin. Guys, testosterone can play a major role in all of those things. Male sex organs, so things like if you want to decrease your risk of prostate cancer, guess what? Optimize your testosterone levels there. If you want to decrease and get rid of erectile dysfunction, get your testosterone levels up. But again, don't rely on an injection to have to do that the rest of your life in order to have that happen. Bone marrow. So yes, testosterone plays a major role in bone marrow and things like red blood cell production. So there's so many different areas that testosterone plays a major role in that I think we have to make sure that we discuss in order for you to optimize your testosterone levels. And I like to say optimize because I'm actually going to go over scenarios where, you know what, you may not have to use the shotgun effect in order to get good results from testosterone. Because the way most people look at it even in the functional anti-aging world, is that, you know what, if there's a hormone issue, let's just replace it, right? Like, you know, if there's a testosterone issue, let's just throw a bunch of testosterone in there. You know, it's natural, so it's okay. We can throw that in there. Oh, you're a woman that you have progesterone issues. You know what? Let's just throw some progesterone in there. And I'm not saying that I'm always opposed. I know that there are certain times and places where that is needed, and I still think that there's better ways to do it, and more bioidentical ways to do it, but not everybody is a candidate for that. And I would actually go off and say that maybe only about, you know, 5 to 8% of the population is really needing some form of bioidentical hormone, you know, replacement therapy. The rest of them, you just need lifestyle change. And I'm going to go into ways that you can actually do that. So, got to take a quick break here. If you are a man, or maybe you're a woman that has a husband or a boyfriend, or, you know, a father or somebody in your life, a male figure that needs some help with their health, or maybe you're just somebody that's a very, very healthy male that wants to take your health to the next level, I'm getting another men's group rolling. We just finished one that was absolutely amazing. We're starting another one. Is kind of the middle part of March. And so now that enrollment is open. Get signed up. Last group sold out, and actually the group before it sold out as well. So if you want a spot, you better get it before it goes away, because they will go away. You can actually go to drswarren.com. There's a banner that you can click on to read more about it. You can sign up for it there. But the best way to do it, you can give Kate a call. That number is 423-362-5360. Again, that's 423-362-5360. And she'll set you up with a free 10-minute consultation on the phone with myself, so I can find out, are you a good fit? Because yes, there's some of you out there that want to do this that are not a good fit. And that's people that again, are not ready to make the changes that I'm going to ask you to make, because I'm going to ask you to work. It's going to be fun, and you're going to learn how to literally change your entire lifestyle and how to do it in a great way, and really learn that process. But some of you are not ready to make those changes. So if that's you, you know, don't worry about it. You're not ready for this sort of go around. But if that's you, give her a call. That number is 423-362-5360. This is Wellness Radio with Dr. Nathan Warren. I'll be right back after the break. All right, guys. So, kind of diving back into the testosterone realm, you know, we went over how it affects muscle, skin, brain, bone, collagen, you know, bone marrow, things like male and female sex organs. So it affects all of those things. So we know that testosterone is a major, major deal. But again, it's not just about throwing more testosterone into the body. There's another side to the coin. It's not just about the shotgun effect. We know that there's also this thing called hormone sensitivity. So most people can get this concept if we talk about, like, you know, when it comes to insulin, for example. You know, most people's doctors are going to explain diabetes as something called insulin resistance, which means that your insulin, even though you may be producing a massive amount, is not binding to the receptors to grab onto that insulin to shuttle the glucose into the cell, because you've damaged and blunted those receptors over time. Same thing happens with testosterone. So that is why, if you are metabolically unhealthy, if you're pre-diabetic, which about 100 million Americans in our country, they are pre-diabetic, so more than likely you are pre-diabetic if you're listening to this show, unless you're some of my listeners on Facebook Live and been following us for a while, you've already made a lot of those changes. But if you are metabolically unhealthy, if you are pre-diabetic or diabetic, you're going to have testosterone issues. I don't care, you know, if it's showing up clinically in your blood work or not, it will show up at some point, and we're seeing it in younger and younger ages. I've even seen it in some of my men that I'm coaching, you know, that are in their 20s. They're having testosterone issues because they're so metabolically unhealthy. So we know that that plays a major role there, and it's all about the sensitivity of that hormone. So that being said, I can have a 65-year-old man who maybe has a testosterone score, you know, maybe it's 400s or 300s, but then I start working with them metabolically. We start getting the cell healthy, like the cell membrane that literally is where those receptors are for testosterone. And guess what they become? They become more testosterone sensitive. So that means they're not getting more testosterone produced, but they're actually binding to the receptors better. So guess what happens to this person? They have a level that's 300 or 400, and their doctor's like, oh, this is low. But they're like, I feel better than I have since I was in my 30s, because they're optimizing their testosterone. That's why I like to use the word optimization, because it's not just about getting more hormone produced. It's also, and I would even argue the most important, it's about getting that sensitivity to that hormone by healing the cell membrane and healing those receptors will make a it'll make the biggest impact really on testosterone levels overall. So we know that that's going to be a major part. And what do we see? So why do we see this decline in testosterone as we age? I would argue it's mainly because we see a decline in our overall metabolic health as we age that's playing the biggest role in that. So we're about to go live, so hang on just a second. All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. We are going over why age and genetics are not the problem, and why you can actually optimize your hormones. You can set yourself up to lose weight. You can set yourself up for great vitality. Men, you can get to a point where you get better circulation and reverse erectile dysfunction. You can build more muscle even as you age. So stop buying into this lie that genetics and aging are the cause of all your problems. It's easy to buy into that. Don't get me wrong. Most of you would rather buy into that lie because then you're just, no matter what my choices are, sorry, I get it from my mom and my dad, that's it. It's easier to say that. And I'm going to challenge you guys, because it shouldn't be, we're not trying to live life in an easy way. We want to actually work at life. Life is more fulfilling when we work. So I'm not going to let you come up with that excuse. That's just not the case. So we're talking about testosterone a little bit. One of the things that I want to kind of go over here is foods that boost optimal testosterone levels, because this is a big deal. We know that our diet and lifestyle play a major role in optimizing testosterone, how they bind to the receptors, right? That sensitivity that we just went over, because again, it's not just about the amount of testosterone you produce, it's also about how sensitive those receptors are to grab onto those testosterone, and hormone, and literally make them biologically active in the cell. So some of the best foods that are out there to boost testosterone levels: wild-caught seafood is a big deal. So wild-caught seafood can be loaded with some of those minerals that are massive for testosterone production. For example, zinc and selenium and iodine. They're loaded with those things that play a major role in testosterone production. So wild-caught seafood can really, really make a big difference. Things like pasture-raised and grass-fed meat. And I would even throw in there organ meats as well. So some of you that are just like, oh, I threw up a little bit in my mouth. Yes, organ meats can be and I would actually say let me repeat, they are the most nutrient-dense foods on the planet. So getting pasture-raised, beef liver is going to be so massively high in just about every vitamin and mineral on the planet. It's actually nature's multivitamin. It will knock the socks off of kale as far as nutrient density. It will beat the crap out of spinach as far as nutrient density. It will destroy blueberries as far as nutrient density. Not that all of those things aren't amazing and that you shouldn't add them to your diet. But again, we know that organ meats can be massively, massively powerful when it comes to vitamin and minerals that you're getting in, especially some of those methylated B vitamins that affect genetic expression and methylation. So again, making sure you're getting pasture-raised meats, beef, bison, lamb, venison, elk, wild boar, wild-caught seafood, wild-caught fish. Getting those things in are absolutely fantastic. And some, again, pasture-raised, poultry and fowl, you can get that in as well. So pasture-raised eggs, absolutely amazing for testosterone sensitivity and testosterone production. And yes, notice again, I said pasture-raised eggs. I'm not telling you to go out and buy, regular conventional eggs for, I don't even know how much they sell for now. Maybe it's 99 cents a dozen, $1. I don't even know. But find a local farmer, get some pasture-raised eggs, go to your local grocery store. Oh, but Dr. Nathan, they're like 4 times more expensive. I don't care. It's like literally like a supplement for you. It's that good for your cell membranes. It's loaded with choline that helps with the brain and helps with your cell membrane that you're not going to find in very high amounts, if at all, in plant food. It's loaded with things like vitamins A, D, E, and K, some of these fat-soluble vitamins. So again, load up on pasture-raised eggs. Spinach. So getting that in, whether it's in raw form or cooked form, spinach is very, very, very high in some of the primary components that will help build up testosterone levels. Garlic is another one. Ginger, avocados, grass-fed butter. A lot of people don't realize that something like avocados, they have the green component of like green vegetables, so they have the chlorophyll component of green vegetables. They have the fat content that's almost unmatched by any other foods. And then they also have a lot of the carotenoids and antioxidants that are matched by certain fruits. So all of that is in one in an avocado. So yes, an avocado a day will keep the doctor away. Grass-fed butter and ghee are loaded with fat-soluble vitamins that are going to really help with good cholesterol production, which is absolutely necessary for proper testosterone production. Raw nuts and seeds, we like getting those because they're loaded with minerals that really help to boost up your testosterone levels. And things like berries, mainly because when you get a lot of antioxidants and polyphenols into the body, and also things like olive oil, what it actually does is it helps to, number one, keep a lot of the damage to your cells, so a lot of the oxidative stress at bay, which can make a big difference. Another thing for boosting some of these anti-aging hormones like growth hormone, testosterone, making you more sensitive, is get what's called xenoestrogens out of the body. And this is something I dive very deep into in my men's group. I dive into how to actually clean up your environment, your house, your products you're putting on your skin, in your hair, in your mouth, all of those different things, how to clean those up, and that alone can boost your testosterone pretty high and really get some major benefits in that hormone optimization as well. So as we're wrapping this up, some of the biggest places you see these xenoestrogens are things like lining of cans with BPA, plastics. So if you're still consuming lots of plastic water bottles or lots of plastic, food that's in plastic, we've got to get those out. Fragrances, detergents, shampoos, perfumes, colognes. Like one of my least favorite places on the planet is to walk through the mall because you can barely breathe because of all the crappy cologne and perfume that's sprayed everywhere. Talk about getting cancer while walking just in a few minutes. Go to the mall and you'll get it in a few minutes. Talk about tanking your testosterone levels. Go walk outside of some of those clothing stores that will tank your testosterone. Things like herbicides, pesticides. Men, stop spraying your stinking yard because you want it to look like a golf course. Grass isn't made to look like a golf course, okay? Find your pleasure in so many different other things, but stop destroying our planet and destroying your health at the same time, and really, utilizing a modern form of castration by utilizing herbicides and pesticides. Stop doing it. I don't care how good your lawn looks. We got to stop doing that to your health overall, because that will tank your testosterone levels. So, again, guys, exercise, get proper motion, proper breath work, proper lifestyle. These are the things I go over in my men's group. So you men that have listened to this and now you're like, crap, Dr. Nathan, you got me. I know that there's so many different factors here that I need to work on. Join my men's group. It's so much fun. So whether you're local to Chattanooga and you're going to come in and do it live in the office, which I think is the best part about it, is we actually get together as men, we talk about these things, we have a lot of fun, but I teach you lifestyle. Over the course of 7 weeks, we actually dive into how to get to the root cause of your health issues. Or if you're from somewhere else, we do it via Zoom, which is a lot of fun as well. So you can go to our website, doctorswarren.com, check that out, and again, you are able to read all about my men's group there, or call 423-362-5360, 423-362-5360. Kate is standing by, and she'll set you up for a free 10-minute consultation so we can find out and discover whether you are a good fit for my next men's group, which is starting in the middle of March. It will sell out, so get your place now, 423-362-5360. This has been Wellness Radio with Dr. Nathan Warren. I will see you guys next week. Have a good one.